The House will come to order. The next bill on the calendar for the day is House File 1794. The Chief Clerk will report the bill.
I have no idea where it is. House File number 1794. An act relating to health occupations, removing advanced practice registered new postgraduate collaborative practice requirements, the first engrossment.
There are no amendments at the desk. The Chief Clerk will give the bill a third reading.
Third reading, House File number 1794.
Third reading. I recognize the author of the bill, the member from Dakota, Representative Virnig.
Thank you, Mr. Chair and members. This is a bipartisan bill brought forth by the Minnesota APRN Coalition, representing the majority of the APRNs across the state. Supporters include the Minnesota Nurse Practitioner Association, the Minnesota Association of Nurse Anesthetists, the Minnesota Affiliate of Nurse Midwives, and the Minnesota Affiliate of the National Association of Clinical Nurse Specialists. The Board of Nursing does not have concerns with this proposal, but the Minnesota Medical Association did testify in opposition. During Minnesota's transition to practice period, certified nurse specialists and nurse practitioners must work in a hospital or integrated clinical setting where a physician is also employed. This limits where certified nurse specialists and nurse practitioners can work for the first 2,080 hours of their career. It prevents many APRN-led clinics from hiring new graduates and certified APRNs to offer essential care around the state. And it makes it more difficult to hire those same graduates later, as once they've already spent a year or more in a new setting, often in a larger health system, they don't leave. House File 1794 would remove this barrier to practice and help solve access shortages in mental health and primary care across the state. 16 states have full access, and this change would align us with other states, including our neighbors, North Dakota and Iowa. This is not a scope bill, but rather we are removing a barrier to the ability for new nurse practitioners and CNSs to gain employment and become full-scope practitioners in the APRN-owned clinics. Advanced practice registered nurses complete a bachelor's of nursing, work in the field for at least 1 year, and complete 2 to 4 years of higher education, including 500 to 1,000 hours of supervised clinical practice before graduating and applying for a national certification and state licensure. This education and licensure requirements prepare them for practice, and I ask for your support.
I recognize the member from St. Louis, Representative Warwas.
Thank you, Mr. Speaker, and I want to thank Representative Virnig for bringing this bill. I am the co-author of this bill, and as all of you know, I am from rural Minnesota, St. Louis County, and it's often hard to staff medical professionals. And this bill really resonated with me when it first came to me, because in my own experience, in 2020, I was seeing my nurse practitioner, and I didn't have any symptoms that indicated it, but I had kidney cancer, and my nurse practitioner was the person that ordered up those tests and got me to a specialist, and it was discovered that I had that kidney cancer, and it was in the COVID response era. I ended up going to the Mayo Clinic in August of that year, and they couldn't save my kidney, but I lost my right kidney that day. I've been cancer-free ever since. But it's occurred to me that I was fortunate to have access to that nurse practitioner. And I credit, I'll just say it, her name, I credit Arla for saving my life. And so, you know, we need more MDs in rural Minnesota, but I believe also that it'll be easier for us to get more medical health professionals, more NPs, into rural Minnesota, into practice, if we can pass this bill. And so I'm grateful to the work that Rep. Virnig has done, and I think we really were able to collaborate well on this bill. It truly is a bipartisan bill. Thank you.
I recognize the member from Hennepin, Representative Mahamoud.
Thank you, Speaker, and thank you to Rep. Virnig for bringing this bill forward. I'm speaking in support of this bill as we consider how to make healthcare more affordable and more accessible. I recently had the opportunity to visit Inspire Clinic within my district with co-chair Bierman and co-vice chair Ryer. This clinic truly reflects what a community clinic is meant to be: accessible, inclusive, and deeply community-driven. During Operation Metro Surge, this clinic stepped up in a remarkable way. They made home visits for those of our neighbors who are afraid to leave. That kind of responsiveness and trust is not built easily, but it's exactly what our communities need. Inspire Clinic is reaching underserved populations and delivering culturally responsive care so that we are managing chronic conditions and mental health issues, all without a physician on site. Yet despite the impact, current contract requirements can cost tens of thousands of dollars, placing a heavy burden on our clinics, working to serve those who are most at need. If we want to deliver care in this way, care that meets people where they are, then we need to continue to rethink our system. We must remove unnecessary barriers, expand access, and center affordability, so I do urge your support.
I recognize a member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, I rise in opposition to this bill, and I want to spend a little bit of time explaining to the members what it is and what it really does. So, you know that in Minnesota, under our current statutes, we only license medical professions or health professions when it's about patient safety. But the reverse is also true, that licensing then should ensure patient safety as much as we possibly can. When we consider changing requirements for licensing, we shouldn't be thinking about whether an employer is going to be able to hire somebody. We should be thinking about patient safety. Patient safety is what licensing is all about. And this bill is not good for patients. So I just heard Representative Warwas talking about his kidney cancer being diagnosed by an APRN, and you know, that's great. I am not here to say that they are not good practitioners. They are good practitioners. They are an important, valuable part of our health system. But the very point that I'm going to be making here is that we want to be sure that those, or as sure as we can be, that those who do get licensed and do go out into practice are able to recognize when somebody has kidney cancer. That is really key here. And so I do want to make sure that you understand I'm not in any way denigrating APRNs. I think they are great and they play a very important part of the system. But think about what the training is for an APRN, an advanced practice registered nurse, as compared to a physician. And I'm going to go through that a little bit. But I want you to realize the broad scope of practice that APRNs have in our system. I'm not saying it's inappropriate for them to have that broad scope, but their training is a lot less than a physician. And right now, under our system, they go out into practice, and they're able to practice, they are able to diagnose and treat diseases, including ordering and interpreting a lot of tests on their own. They do primary care, they provide some specialty care, they do preventative care, and they have full prescribing privileges. Full prescribing privileges. And that's fine. They mostly do very well, and they do this without any physician oversight. So once they become fully licensed, they are on their own to do pretty much what a physician can do, with some exceptions. But they are out there practicing on their own, and they have tremendous responsibility. All this bill is doing is removing one requirement for licensing, and that requirement is that before they go into practice, they spend 1 year working collaboratively in a system with physicians. Just 1 year. At the beginning of what could be a 30 or 40-year career. We're asking them to work 1 year with physicians, not to pay for training for another year, not to be in a training program for another year, just to work in a system where they're interacting with physicians. Why? Because any practitioner who goes into practice, you don't know what you don't know. And this is what the current requirement is, to give a little bit of a fighting chance to have a bigger view of what the system is, to understand the role of advanced practice nurses, to understand what physicians do that might be the same or different, and maybe even to have some connections there to ask for help when they might need it. And what this bill is doing is just saying, nope, that's too big of a burden. We don't want to make them do the extra year, a year of practicing, mind you, not training, just practicing, in a place where they have an opportunity to interact with physicians and learn a little bit more about what they might not be recognizing, so that hopefully the next patient, Representative Warwas, they would recognize if they had something that was more serious and be able to refer that person to the appropriate place. It's just an extra layer of training. So let me just be clear what the difference is between APRNs and their training and physicians. So an APRN has an RN degree, which, as you know, can be as little as a 2-year degree, and they can have as little as 2 years of the additional training to become an APRN, essentially the medical training piece of what they do. They can have more than that, but that is the minimum of what they have. In contrast to that, a physician has 4 years for a baccalaureate degree, and then 4 years of medical school, and then has at minimum a year of training as what we used to call an intern, a 1-year residency at minimum. And most now have 3 to 7 years of residency, additional training. And the scope of practice of an APRN is basically the same. And if you like what they're doing in rural Minnesota, as you know, in rural Minnesota, they're probably going to have a lot less connections to, other practitioners when they're out there. They're going to be more on their own. And what the bill is asking us to do is get rid of that 1 year of practicing within a system. So in the face of the physicians having a lot more training to start with, we still require them to do a year of additional training. After medical school, after the 4 years, they must have at least a 1-year residency to be licensed. And that's not working. That's not earning a full physician salary. That's training, usually at a reduced salary and reduced responsibilities. So all we're asking of APRNs under the current law is to have 1 year working at the start of what could be a very long career working with physicians in some capacity. So, I heard one of my colleagues say that this is to help make healthcare more accessible and affordable. And I have to tell you, there is no evidence that it will do that. We all want that. And no one is trying to stop APRNs from practicing or limit what they can do. This bill is intending to remove a very reasonable requirement of their practice to make sure that they have that little extra bit of understanding the system, understanding maybe what they don't know before they go out and diagnose somebody's kidney cancer or something else serious that they might miss just from lack of experience. When physicians go through their training, one of the things that happens is that they see many, many, many patients. And that's why the best training programs are ones that have a huge volume of patients. And why is that? It's because in medical training, if you don't ever see it, you might not recognize it later. The idea is just to see different kinds of illness, different types of patients, just to get that experience. We're not asking APRNs to do that. We're not asking them to undergo a residency. All we're asking them to do is work and be fully paid in a place where there are physicians before they go out and work on their own. I don't think this is a barrier to practice. I think it's the very least that Minnesota patients can expect to be able to have some kind of quality control for people who are not going to be asked to work with physicians really for the rest of their careers. Because again, there is no requirement for any kind of physician involvement or oversight with APRNs once they become licensed and once they've completed this 1 year. So I'm going to ask members to vote no on the bill. I have sent around some documents that from the Minnesota Medical Association. I see one of them on my desk. There are also a couple of letters from not only from the Minnesota Medical Association itself, but from the American Academy of Pediatrics, also saying that this is not a good idea. So I hope members will vote no, just because, a practitioner, any class of practitioner, thinks that they know all they need to know, doesn't take away our responsibility as lawmakers to make sure that that is in fact the case. So thank you for listening, members. Please vote no.
I recognize a member from Anoka, Representative Scott.
Thank you, Mr. Speaker. I'm wondering if the bill's author would yield to a couple of questions.
She will yield. Representative Scott.
Thank you, Mr. Speaker. Representative Virnig, I'm really conflicted on this bill. And so could you help me understand what that 1 year time period where currently they're under the authority of a physician, what does that look like on a practical everyday basis?
Representative Virnig.
Yes, thank you for the question. I suppose that depends on what clinic you're at. It is a collaborative agreement. We did send out a letter here, and if you are at a clinic in Greater Minnesota, I forget how you say it, Sella Wellness, you're paying an MD who doesn't come, who doesn't collaborate, and who's not participating, so you can meet that requirement. In my research, because I've been working on this for 3 years and connecting with folks, sometimes they're paying medical providers out on the coast to do the work or to be part of the agreement, and they don't ever meet them in person. It's not like it's a mentoring program where you're collaborating together on a routine basis.
Representative Scott.
Mr. Speaker, and thank you, Representative Virnig, for that information. If she would yield to another question?
She will yield. Representative Scott.
Thank you. Is that the norm, the exception, or is it a combo? I mean, are there actually in the state of Minnesota instances where the physicians are like one-on-one or one-on however many ALPRNs they have, where they are actually working alongside those folks so they get that experience?
Representative Virnig.
Well, thank you for the question. I haven't spoken to every clinic, so I can't answer, but the clinic, the APRN-led clinics that I've spoken to, the APRNs that I've spoken to, who've been part of this, have talked about how there is not a collaborative engagement occurring.
Representative Scott. Any further discussion? Seeing none, I recognize the author of the bill, the member from Dakota, Representative Virnig.
Yes, thank you. Thank you so much for the discussion, and Representative Liebling, Chair Liebling, I hear your concerns. I do want to note that there is, in committee we had some letters submitted, and one of them talks about evidence that supports retiring this outdated law. It states that there is no evidence that these mandated contract periods are necessary or beneficial for patients or providers. There is a growing body of research on healthcare quality and cost outcomes in states that have retired government-mandated post-licensure agreement requirements. These studies found that states without this barrier have maintained quality healthcare outcomes, have lower hospital admission rates, and perform better on key healthcare measures. I think it's important to note that no state that has adopted legislation similar to this has ever returned to a more restrictive model, and that these states have maintained a competitive advantage. I'd like to thank Chair Bierman and Chair Backer, as well as my colleagues on both sides of the aisle who helped get us this far. Removing this statutory barrier to practice would help expand access to care services across the state, from school-based health centers to small community-based practices. Now is the time for change. Vote green, please.
There being no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the name of the member voting remotely.
Momani Hiltsley.
Whose bill is this? Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 119 yeas and 12 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 4595. The clerk will report the bill.
House File number 4595, an act relating to health occupations, modifying requirements for licensure by reciprocity for marriage and family therapists.
I recognize the author, Representative Schomacker, who will explain the bill.
Thank you, Mr. Speaker and members. As the leading advocate for both marriage and family, I have a bill today that will increase access to marriage and family therapists and mental health care in Minnesota at no cost. I would first like to thank my many co-authors on the bill, including co-chairs Bierman and Backer, and Representatives Franzen, Curran, Schwartz, Bonner, Nadeau, Carroll, Rapinski, Lilly, Zeleznikar, and Gilman. Minnesota is facing a shortage of marriage and family therapists, and one barrier is the difficulty licensed therapists from other states face when trying to become licensed in Minnesota. This proposal updates Minnesota's marriage and family therapist licensure reciprocity law by moving the requirements from administrative rule into statute and simplifying the process for qualified out-of-state therapists to become licensed in Minnesota. The bill eliminates the 5-year waiting period and removes the equivalent or substantially similar experience requirement that has made licensure difficult for many qualified applicants. Instead, the Board of Marriage and Family Therapy must issue a Minnesota license to an applicant who holds a valid, unrestricted marriage and family therapy license from another state, is in good standing, passes a background check, and completes Minnesota's jurisprudence exam. 14 other states have already adopted similar licensure portability standards, including our border state, Iowa, and is being considered in other states as part of a broader national effort to improve license portability. I also want to note that the licensure portability is different from an interstate compact. Given the size of the marriage and family therapy profession, a compact would be costly and complex to implement, and 2 of the states with the largest number of licensees are notoriously against compacts. Licensure portability is a more practical approach that still allows Minnesota to maintain full oversight of licensure standards while reducing barriers to qualified providers. Most importantly, this proposal does not lower Minnesota's standards. Licensed therapists in other states must have graduated from an accredited program, completed the supervised clinical experience, and passed the national licensing exam. You have a letter of support in your materials that were handed out earlier today from the Mental Health Legislative Network, and the Board of Marriage and Family Therapy is neutral on this bill. This bill removes unnecessary barriers while maintaining Minnesota's high professional standards by allowing qualified licensed therapists from other states to more easily get licensed in Minnesota. Thank you for joining me in support of marriage, family, and mental health. I ask for a green vote.
There are no amendments at the desk. The clerk will give the bill a third reading.
Third reading, House File number 4595.
Third reading. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Schomacker, for bringing this bill forward. I commend you for the thorough explanation of the bill. It does all the things I was going to say as well. But I think addressing that shortage and taking away some of the onerous requirements is really important. And then, of course, the no cost to expand our healthcare provider system. Very good bill. Members, please support. Vote green.
I recognize the member from Meeker, Representative Gilman.
Thank you, Mr. Speaker. Marriage and family counseling is vital to the health of a lot of couples' marriages. A few things I just want to talk about, again, from my own experience, is having more tools in the toolbox is always helpful. And if we can make Minnesota marriages stronger by passing House File 4595 today, I'm excited to be a part of that movement. So again, improving communication. Therapists are so great at helping folks identify cycles and patterns. So they can help break that down for us. Navigating high-stakes issues, neutralizing things that have been hot topics, rebuilding intimacy and trust, and identifying blind spots. Again, there's reoccurring problems and patterns that can happen in anyone's marriages, healthy or not. So again, I'm excited to be a part of this. Over 90% of couples report improved emotional health, and 2/3 experience better relationship satisfaction. So I'm excited to be a part of this. This weekend, I got to see something happen with a dear friend. They've been married for over 25 years, and she is learning now in her 50s how to just ask for simple things like things her heart's desire, things she'd like. Hey, want to come home? I'd love to see you. Things like that have been a little challenging. So to have more opportunities for folks in Minnesota to have support systems and people to help give them the voice they need, I'm excited to see the divorce rate go down in the state of Minnesota. Thank you so much. Please vote green.
Any further discussion to the bill? I recognize the member from Rock, Representative Schomacker.
Thank you, Mr. Speaker, and thank you for the support from those who spoke today. You know, so often around here, we really have trouble knowing what other people think of us. We get into that habit. If you've been here for a while, you know that when you go from the majority to the minority, sometimes your jokes become funnier or your ideas become smarter, those types of things, but you never really get an idea of what people really think of you. But when I introduced this bill, I really got an idea of what people thought of me. And I've been hearing again and again from some people just countless times about how when they see my face, they think marriage and family. And it's just so meaningful to me. It means so much. Please vote green.
There being no further discussion, the clerk will take the roll. The clerk will call the name of the member voting remotely.
Momani Hildsley.
Momani Hildsley, aye.
Momani Hildsley votes aye.
The clerk will close the roll. There being 133 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 4493. The Chief Clerk will report the bill.
House File number 4493, an act relating to health occupations, authorizing pharmacists to initiate, prescribe, administer, and dispense certain drugs for the treatment of opioid use disorder.
I recognize the member from Candy, Ojai, Representative Baker.
Thank you, Mr. Speaker and members. I'm really proud today to bring House File 4493 to your desk in asking you for the support that I believe will literally save a lot of lives, because at the moment, folks are in that in that really it's literally the moment I need help right now. I need it today. They just hit rock bottom. Something happened to them. But putting this bill and giving us more tools with our health providers, the pharmacists, that is likely the one health provider that we all see the most, especially in greater Minnesota, gives them the chance to be able to now prescribe buprenorphine and or otherwise known as Suboxone. Those medically assisted treatments have proven time and time and time again that having that access to that right at the time when you need it is life-changing. This bill brings good steps towards that outcome by providing the pharmacists the ability, with some training, optional training, to be able to prescribe those medicines at that moment. This will provide people to get through the worst part of their journey to recovery, which is getting them through withdrawal. If you know anything about this disease of addiction, the withdrawal is the moment and the worst part, and that's what's preventing people from actually getting help. What we have learned in recent years, buprenorphine is the evidence-based, holy smokes, where has this been for a long time? Because we need something like this. Before this, there was methadone, and methadone is highly controlled, hard to get at, daily dosages when you got to get in a car or got to go somewhere to a hospital or a clinic and get this. It is so clunky. This is hard to do. It's still important that it's there, but this setting it up with our pharmaceuticals, our pharmacies in our communities will be a huge step forward. So I ask you that when you know of anybody that is searching for that kind of help, in a couple years ago, you had to make an appointment with your doctor. You had to go see and get a prescription for this if you wanted to do that. If you made it, you might have had to wait a week or two to get to get to your doctor, and that week or two, if you really want to be trying to start recovery, you are so sick that you can't function, and you sometimes can't wait that long, so you start using again. That's the problem with this thing. This is a very good bill. I wish was here earlier. I wish it was here years ago. This is going to be a really good bill. Our pharmacists like it. Our providers like it. It's accessible. This drug is proven. And I would hope that we can move this along forward. So with that, Mr. Speaker, I'll happy to take questions. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 4493.
Third reading. Discussion. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Baker, for bringing this bill forward. As you mentioned, this bill, it is really an important bill. It is a life or death bill for many people who are seeking substance use disorder treatment and don't get it in a timely fashion. So I really appreciate you bringing this forward. And, you know, this issue, substance use disorder treatment, I think a year or two ago, I saw a scale that said 80% of the people needing it don't get it at the moment they need it. And we're making some progress. But this will be a big step forward to have pharmacists able to prescribe and to get that treatment out there when people are needing it and are assessed for it immediately, not waiting for days for prior auth or waiting for prescription through an MD. This can be done at the moment of contact for trained professional pharmacists who know what they're looking at with the patient before them. I also, just want to give a shout out to Rep. Baker with this bill, because when it first came across and I read it for the first time, I had concerns about it. And I wanted to bring an amendment, and I contacted him and I asked him to hear me out, and his first thing that Rep. Baker does is he listens. And he was open to whatever I was suggesting. And he wanted to have follow-up. And he directed me to his associates who helped write the bill. And it really helped alleviate some of my concerns with that. So The bill was very tightly written, and I appreciate the work of Rep. Baker in this area. And also, I commend him for all of his work all these years on the Opioid Epidemic Response Advisory Council. He's a leader of that organization and doing excellent work. And there's such a need for substance use treatment in this state and in this country. And I would ask, if you have time, to go downstairs and look at the organization that has the posters up today for victims of fentanyl overdose. And I would ask you to just walk through there and take a look and read some of those banners and educate yourself more on this issue, because this is far from over. We're in at least our fourth wave of the opioid epidemic, and the reasons are different, but we need to continue to address it. And Rep. Baker, you've always been on the forefront of that. I appreciate your work, and thank you. And members, please vote green.
Further discussion? I recognize a member from Candy, Ojai, Representative Baker.
And thank you, members, and Mr. Speaker, and Representative Bierman. Thank you also for serving on the ORAC Council. We are doing amazing work around the whole state of Minnesota, because we were actually leaders in finding dollars from Big Pharma to get them to pay us through registration fees. We were two or 3 years ahead of the national lawsuits and the settlements that were coming. So Minnesota, we have done a lot of really good things around this area. And as you mentioned too, on the east side of the Capitol, on the ground level, there is a number of posters and displays for this entire week for the organization called Friends of, that's the Fentanyl Advocacy Group. And when I'm there this morning, did a short little program. There's my son, Dan. And you know, you don't see his picture every day. Well, I guess I do, but when you're around the house and here, you sometimes let the time helps heal. But when you get that moment where here we are, loved ones are downstairs on display that we could not save, because at that time, there was nothing like this at all, to be able to offer my son when he needed it at that moment. We were wound up with getting to the doctor and giving it time, and he had to be completely free of any opioids or anything in his system before you started taking this buprenorphine or methadone. At the time, this was 15 years ago when I lost my son, methadone was sort of the medically used drug at that time to help people block the craving of needing that drug. That was the real trick, but it was highly regulated. Suboxone came around and it made it a lot easier. Still, I go to the doctor, but now in Minnesota, because of a law change in the federal government in 2025, but states have to approve this so that our pharmacists can be FDA approved by this 8-hour training. It's voluntary, they can do this. We got to get this out the door right now, folks. And so I'm really, really proud of my son for telling me, Dad, we can do better in this area. We can help more people. I didn't have these tools then, but today, folks that are ready to be done with this, ready to get out of this cycle of addiction and disease, we're ready to do it today with this bill. This will be one of the best bills, I think, that I've carried to the Minnesota House. So members, I hope you do light up this board for everybody you know, every loved one that you have heard that is lost, and all the advocates, and every single member that's here, and the people that helped us all pass legislation on this issue. We're going to save people, because they're going to be able to go to the pharmacists that they probably see the most of anyone in our health provider world. They can start doing things as well. So, members, I really appreciate the green vote. Thank you again, Mr. Speaker.
Seeing no further discussion, the clerk will take the roll. The chief clerk will call the name of the member voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the House calendar for the day is House File 3832. The Chief Clerk will report the bill.
House File number 3832, an act relating to health, adding a definition of compounding of a drug to exempt the use of a flavoring agent.
I recognize the author of the bill, the member from St. Louis, Representative Zeleznikar.
Thank you, Mr. Speaker and members. House File 3832 modifies the definition for compounding a drug to exclude a flavoring agent. So it does not, because it does not change the drug's intent. This is necessary to give clarity in the Board of Pharmacy to the rules. And this is something that's important for all ages. There's times when you could have a medical condition where your taste changes, whether it's cancer. It could be a young child that needs penicillin, and they probably need it flavored. You might have a child that has had many different strep throat, comes to mind. But oftentimes you need a flavored medication to make the ease of administration happen. So this is a very simple bill. It gives clarification so that this can occur in nursing homes and assisted livings. There's time you have to crush meds and often put it in pudding so that you can ease the administration of medications for people with swallowing issues. And this is in the same lane, trying to make sure that you can have a better experience as you're doing healthcare delivery. I urge you to support the bill. Thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 3832.
Third reading. I recognize the member from Dakota, Representative Bierman.
Thank you, Mr. Speaker. Thank you, Representative Zeleznikar, for bringing the bill forward. This bill reminds me when my kids were young, trying to get them to take meds at home in the middle of the night. And, I had one who would eat anything, and I had the other one who would not eat anything. And the struggles we went through, it's good to see that this is happening, and it's going to make it easier for palatability for not only kids, but as you mentioned, adults. And if you can't take the meds, they're not going to help you. So thanks for bringing this forward, putting it in statute, making it more accessible. Appreciate the work, and vote green. Thank you.
Any further discussion? I recognize the author of the bill, the member from St. Louis, Representative Zeleznikar.
Thank you, Mr. Speaker, and thank you, members. I'd like to thank Representative Carroll for his bipartisan support, and in the Senate, Senator Mann. And this is a bipartisanly supported bill, and urge a green vote. Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will call the name of the member voting remotely.
Momani Hiltsley. Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 3917. The Chief Clerk will report the bill.
File number 3917, an act relating to health, modifying medication repository program procedures.
I recognize the author, Representative Mahamoud, who will explain the bill.
Thank you, Speaker. And members, this bill strengthens Minnesota's medication repository program by reducing medication waste, and it will expand access to vital medications for more Minnesotans. Every year in Minnesota, we destroy nearly $16 million worth of safe, unused medication, while many Minnesotans are forced to skip and ration their medications. Most of the waste that comes from long-term facilities as patients' dosage may change or they become hospitalized, leaving medication in its original packaging and unused, becoming waste. The work that is being done is amazing. The repository collects safe, unused medications that would have been destroyed and instead redistributes them to low-income Minnesotans. And they have redistributed millions of dollars worth of medications and kept 5 million doses out of waste waters. And this legislative body made a very impressive, smart investment in the repository. As for every dollar that was invested, about $3 worth of medications reached patients. This bill looks to further improve the program and expand its reach to more Minnesotans by allowing flexibility and the dollars that were already appropriated to the repository and making it flexible to spend so that they can expand their business model, which would include home delivery to mobilely limited patients and to expand access in rural Minnesota. The repository receives a large number of donated medications that they are unable to use and accept. As a result, we are changing some of the recording requirements, record keeping, so that destruction documents are only required for medications that were formally accepted by the repository. I ask you to support this bill, members. This is a great bill. Thank you.
I recognize the member from actually, let's give it a third reading.
Third reading, House File number 3917.
Third reading. I recognize the member from Traverse, Representative Backer.
Yeah, thank you, members. This is one of those reasonable bills because, you know, it's important that people are getting these drugs, that they're safe, and also we have clear directions on how to dispose them, and it gives additional oversight. I mean, to help the people who need this the most. So I would ask for a green vote because it makes this program safer, and that matters. Thank you.
Any further discussion? I recognize the author of the bill, the representative from Hennepin, Representative Mahamoud.
Members, this bill reduces waste, improves access, and makes most of our resources better used in the system that we currently have. So please support the bill. Vote green.
There being no further discussion, the chief clerk will take the roll. The chief clerk will call the name of the member voting remotely.
Momani Hiltsley.
The clerk will close the roll. There being 132 yeas and 1 nay, the bill is passed and its title agreed to. The next bill on the House floor today is House File 4146. The chief clerk will report the bill.
House File number 4146, an act relating to natural resources, providing temporary authority to store drill cores outside the drill core library.
I recognize the member from Itasca, Representative Igo.
Thank you, Mr. Speaker. This is a pretty straightforward bill. Pertains to my district in the drill corps library in Hibbing, Minnesota. So right now, the drill corps library is at capacity, which houses geological samples from across the state of Minnesota. But due to state law, all core samples must be open to the public for viewership. So what this bill does is allows for cold storage of this extra geological data from around the state to be put into cold storage while we continue to build out and expand the drill corps library so that Minnesotans will be able to come and see it when it's done and complete. So pretty straightforward bill. Looking forward to support.
There are no amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, House File Number 4146.
Third reading. Discussion. I recognize the member from Ramsey, Representative Fischer.
Thank you, Mr. Speaker. I rise in favor of the bill. Thank you, Representative Koegel, for bringing this forward. This is critical to make sure that we're preserving our assets that we have. This is one of the largest core libraries in the country. Appreciate your work on it. I encourage green vote.
I recognize the member from Crow Wing, Representative Heintzeman.
Thank you, Mr. Speaker, and thank you, Representative Igo. I will just echo the comments of Chair Fischer. This is a great bill. Fully support this, members. I'll be agreeing as well.
Any further discussion? I recognize the author of the bill, Representative Igo.
Thank you, Mr. Speaker, and thank you, members. This bill rocks. Vote green.
There being no further discussion, the clerk will take the roll. The clerk will call the name of the member voting remotely.
Momani Hiltzley.
Momani Hiltzley, aye.
Momani Hiltzley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 4224. The Chief Clerk will report the bill.
House File Number 4224, an act relating to the environment, modifying notice requirements for water discharges.
I recognize the author, Representative Fischer, to explain the bill.
Thank you, Mr. Speaker. This bill is to put into statute what is usually common practice right now. Currently, when there is a discharge into the water supplies right now, we're required to notify the public downstream. One of the areas that has not been clearly called out is making sure that tribal nations are made sure that they are involved. While that is practice right now, it's not spelled out in the statute. We'd like to add that to statute. I'd encourage a green vote.
There are no amendments to the desk. The Chief Clerk will give the bill its third reading.
Third reading, House File Number 4224.
Third reading. I recognize the member from Crow Wing, Representative Heintzeman.
Thank you, Mr. Speaker. And similar to the previous bill, I'd just like to encourage members to support this bill. When we're talking about a discharge, it's not necessarily a pleasant conversation, but there are examples where it is something of a concern, and that's why there's a notification process in place. Again, encouraging a green vote. Thank you, members.
Any further discussion? I recognize the member from Ramsey, Representative Fischer.
Thank you, Mr. Speaker. This is a good way to put our practice into law. Thank you, and ask for a green vote.
There being no further discussion, the clerk will take the roll. The Chief Clerk will call the name of the member voting remotely.
Momani Hiltzley.
Momani Hiltzley, aye.
Momani Hiltzley votes aye.
The clerk will close the roll. There be 134 yeas and 0 nays. The bill is passed and is titled agreed to. The next bill on the calendar for the day is Senate File 1251. The Chief Clerk will report the bill.
Senate File number 1251, an act relating to game and fish, removing expiration of crossbow hunting and fishing allowance.
I recognize the member from Crow Wing, Representative Heintzeman.
Mr. Chair and members, I'll just give a very, very brief history of crossbows and how we have arrived to this bill here on the floor today. 3 years ago, your only option if you wanted to participate in the archery season and use a crossbow was if you had some kind of an issue and couldn't draw the legally required weight on a vertical bow. And a bill was passed that would allow all Minnesotans to participate who are of legal age in the use of a crossbow. The timeline was a 2-year timeline initially, so a sunset was in place. And DNR came back to the legislature just recently, and the results were excellent. We saw increased participation of young people, and we saw increased participation of those that were older as well. So that time of the year when it's warmest and honestly the most opportune time to be out in a blind or in a deer stand of sorts, a deer stand, crossbows have really taken hold in Minnesota. We want to be able to continue forward. So if you've purchased a horizontal bow, crossbow, which many, many thousands of Minnesotans have, this removes the sunset, and we will continue to allow those that want to exercise their early season deer hunt opportunity with this crossbow and with this bill moving forward today. That's an explanation of the bill. Thank you, Mr. Chair.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 1251.
Third reading. I recognize the member from Lyon, Representative Swazinski.
Thank you, Mr. Speaker. Thank you, members. I want to thank all the members that sit on the Environment Committee for moving this forward. I think as we're debating any issue, listening to those young people that surround us is a big deal. And in this particular case, there's two issues that my daughters have talked to me about. It's one, being a server at a restaurant and be able to serve at 17. And legalizing crossbows for time moving forward. I can tell you in this last year, spending time in the deer stand with 3 teenage daughters, as you can imagine, could be interesting, but because of a crossbow, we were able to bring those times together. Some of them brought books, some of them brought homework, and we also brought a crossbow, and we were able to share that time together. And so I want to thank Representative Heintzeman, I want to thank Representative Fischer on this bill and moving this forward. I know there are some folks against it, but in reality, this is an opportunity to get young people, especially young women, integrated into the sport and moving forward. So I want to thank those representatives and all you for supporting this. Thank you.
I recognize the member from Ramsey, Representative Fischer.
Thank you, Mr. Speaker. I rise also in support. This has been a great bill. Thank you, Chair Heintzeman, for bringing this forward. This is something that's been a long time coming. I remember years ago when the debate first started, it was very controversial. I'm glad to see we are in this space. I would recommend a green vote. Thank you.
Any further discussion? I recognize the member from Wright, Representative McDonald.
Thank you, Mr. Speaker. I rise to support this as well. Not only is it good for the young, new hunters, it's also good for the older hunters who maybe can't pull back a bow anymore. And, well, there are some of you old folks here. I can see there's a couple of you here, a couple behind me. So it's a very good bill. It's a very good idea for Minnesota, and this works so well. I've had some older cousins of mine that have picked up a crossbow. They cost thousands of dollars. So they've invested in this new wave of hunting, and it'd be a shame not to renew it. For that. It's great for the economy, it's great for the youth, and it's great for the older hunters who love to hunt earlier in the season when it's not so cold. and get that prize deer in the first place and be done and be able to feed their family. So it's a good bill. I just wanted to speak briefly on it. It's very good for old people as well. Older, seasoned hunters. Mr. Speaker.
Further discussion. I recognize the member from Crow Wing, Representative Heintzeman.
Thank you again, members. And this is one of those things we've been talking about quite literally for decades. And to quote a very famous member of this chamber, today's the day.
There being no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the name of the member voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 133 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is Senate File 3868. The chief clerk will report the bill.
Senate File number 3868, an act relating to commerce prohibiting virtual currency kiosks.
I recognize the author, the member from Anoka, Representative Koegel. Before you explain your bill, do you want to put the House language into your bill?
Yes, Mr. Speaker.
The chief clerk will report the amendment.
Koegel moves to amend Senate File number 3868, the first engrossment, as follows. The amendment is delete everything after the natural clause, insert the following language of House File 3642.
I recognize the member from Anoka, Representative Koegel.
Thank you, Mr. Speaker. Members, Senate File 3868 is a bill that prohibits crypto kiosks in Minnesota. Because these kiosks are relatively novel and minimally regulated, we have heard from our law enforcement that they are the prime target for scammers who are looking to take advantage of us or our loved ones. Because of the nature of cryptocurrency, these fraudulent transactions are often irreversible and incredibly hard to track. For instance, an entire life savings can disappear without any recourse or restitution. The services these kiosks offer are redundant at best, as most people wish to purchase or sell cryptocurrency using an app like Coinbase or Robinhood that allows them to do so. Actually, just this morning, I got an alert on my PayPal account that there was an unauthorized access to my account linked to Coinbase. And so luckily I was able to get on top of that because I knew what to look for. So this bill gives us an opportunity to work across party lines and protect people from Minnesota from these irreversible crimes. The House language includes our most up-to-date definitions that we believe are more robust and address a loophole where stores are placing QR codes on the countertop that effectively act as a kiosk. The definition was taken from Representative Allen's bill, and the House language also staggers the effective dates of the repealer to allow for the following to take place in this order. So August 1st, the kiosks will be unplugged and no longer available for use. December 31st, all of the kiosks will have to be physically removed. And January 17th of 27, the existing refund policy from the bill passed in 24 ends. And so the refund and the payout provisions overlap to this date, so that to be doubly sure that people have been victimized can be made whole by these scams. So with that, I ask for your support on Senate File 3868 as amended.
I recognize the member from Anoka, Representative Niska.
Thank you, Mr. Speaker and members. Thank you, Representative Koegel, for your work on this bill. Representative Perryman as well for your work on this bill. You know, this has been a serious problem. We tried to kind of do some working around the edges to make sure that we figure out how to reduce these scams. A couple years ago, Representative Hemmingson, then Representative Hemmingson-Yager, I know, and I had some good discussions about how to do this. I just want to make clear to everybody, cryptocurrency, blockchain technology, that stuff is happening. It will continue to happen. This doesn't regulate that. Anyone who wants to trade or invest or explore that technology, there are plenty of ways that you can do that in a way where KYC, know your customer regulation is being exercised, and that there's not some potential to be scammed. But what we're talking about, the crypto kiosks in a convenience store or in a Walmart, has really been shown to only be used for really one of two purposes: crime through money laundering, or crime through some sort of being the back end of some sort of a scam. I personally did have an elderly family member who was scammed and kind of convinced to send money through one of these crypto kiosks. There's really no good reason for these to continue to be available and in our state. If you want to explore cryptocurrency, there are plenty of just like brokerage front-end accounts that you can use to that you have to verify your identity, just like you would investing in securities or investing in a bank account. And then you can trade and you can trade back into currency. So this is a good bill. It's gonna have positive effects on preventing crime, and it doesn't do anything to regulate, this new emerging technology or prevent people from exploring this new emerging technology. So I urge members to support this bill. Thank you, Representative Koegel, and for those who've worked on the bill.
Any further discussion? Seeing no discussion on the amendment, all those in favor of the... I recognize a member from Dakota, Representative Roach.
Thank you, Mr. Speaker. I rise in opposition of this bill. While I recognize, and I've heard many stories about the fraud that is persistent with the crypto kiosks, one of the things that I think is of all the stories is we've heard about the fraud that's happening on the inputs. As far as, somebody who is a vulnerable adult or elderly who is getting scammed, who is taking money from their bank or from their home and inputting it into the machine, and that money being scammed from them. I think there's ways that we can regulate this that would prevent that from happening by just getting rid of the input option on these machines. I think us as a body, just getting rid of an industry altogether in a market, it's a little bit too far. In some ways, I think it's a little bit lazy. And I would hope that we could put some regulation on it that helps consumers. We've done some great things both last year and this year. This year we passed House File 4502, which is a trusted persons program, which allows individuals to be on a bank account so that banking institutions can reach out to people if they feel like one of their loved ones is being scammed. And so I think that's really good for consumer protection. Last year, we passed the Minnesota Consumer Protection Resolution Act, which helps reimburse those members of our community who have been scammed and ripped off by fraudsters with things like this. But again, I think this is just a step too far in the legislative body to completely get rid of an industry within the market. This is going to have potential negative impacts on some of our small businesses. They rely on as many revenue sources as they can. And for us to take away from that in the market and not have their ability to have consumers come and cash out on their crypto wallets, I think is a problem. So I'm against this, and I support a no vote.
I recognize the member from Stearns, Representative O'Driscoll.
Thank you, Mr. Speaker and members. The amendment that's before us, I encourage a yes vote on it. This puts this language consistent with the information and the policy, or I should say bill language that we heard last week in the Commerce Regulatory Policy Bill. This is definitely an area that needs some help in the state of Minnesota. The Commerce Committee, when we were looking at this and working with others, lots of issues, lots of problems, and what our recommendation was is let's pull them off the market and let's look at regulation when we've got more time to be able to do that and see if there's a way that we can bring it back in the kiosk form. Remember, again, members and those who are have an interest in this, there is no ban on online or opening up an account or going to purchase cryptocurrency and other methods and mechanisms. It's to prevent the fraud from people calling and reaching out to folks and telling them to go to these crypto machines. And again, as soon as money is put in here, it's one digital wallet to the next, to the next, to the next, and it was faster than, and it happened faster than I could tell you to the next, to the next, to the next on this. And that money is unable to be retrieved or unable to come back. And so let's protect Minnesotans, and then we'll look to see if we have some regulation in the future that we can do this, but right now we need to get a cap on this. You don't put a partial fire out and say, we'll see what we can do to prevent the fire. You put the fire out, and then you rebuild, and you figure out how to make it stronger, better, faster than it was before. Members, vote yes on the amendment and vote yes on the bill. Thank you.
Any further discussion? Seeing none, all those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There are no further amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, Senate File Number 3868, as amended.
Third reading. Discussion. I recognize a member from Stearns, Representative Perryman.
Thank you, Mr. Speaker. I rise in strong support of this bill because I rise in strong support of law enforcement in my community and stopping fraud in our state. I want to thank Sergeant Jake Lance of the St. Cloud Police Department for educating me on the issue of crypto kiosk scams and their impact in my community. He came to St. Paul to tell our committee the story of a 78-year-old woman who was conned by a criminal scammer into sending them money through a crypto kiosk. She lost $80,000. We quickly learned that this is not just an issue in my community, but one that spans across the state. Law enforcement leaders in Sartell, the city of Ramsey, Elk River, Apple Valley, Minneapolis, Faribault, Benton County, Woodbury, Forest Lake, and the Minnesota BCA have all written letters telling us about the out-of-control levels of fraud happening with these crypto kiosks. I'm hesitant myself, too, to reach too far into the private market. But when there is no legitimate purpose for something and we're seeing this level of fraud, look at Iowa, Attorney General that found 90% transactions through kiosks were scams. We must do something to help our law enforcement stop these scams like they're asking us to. And we should consider who is losing the money in these scams. It's largely our seniors, who are scared to tell their family, I was just scammed out of the money, and how vulnerable they are. The FBI reported more than $107 million in stolen money from victims over 60 years old, and we heard about the statewide impact on these scams from our various law enforcement agencies. We know these scams are underreported, as many victims are afraid to come forward about their losses. Thanks to AARP also for bringing this to our attention. This is a good bill with good bipartisan authors. I thank all the authors. I urge you to support our law enforcement, stop fraud, and vote green. Thank you.
I recognize a member from Hennepin, Representative Greenman.
Thank you, Mr. Speaker. And I just wanted to thank Chair Koegel for bringing this bill. And the reason I'm rising is this issue was brought to me, as I think I heard in Representative Perryman's speech, from constituents who, I had a constituent named Jim Glass. He's very involved with the AARP. He brought this as a real issue of concern that people are facing. And this is one of those bills that comes from constituents across the state who are saying, this is a thing that's ripping people off. can you do something about it? And why I am proud of this bill and how it played out is I think we have all been hearing that from our constituents, and this is a good opportunity to say we are listening. And I really actually appreciate the things we have done last year, right? The consumer protection accounts and other things. I think we need to continue to do that work. But this, I'm very proud, and I'm proud to, when we take this vote and vote green, I hope everybody votes with green. I'm proud to tell Jim Glass that we did this, that the Senate did this, and that it will become law, that we are protecting seniors and everybody who are getting ripped off by these crypto kiosks.
Any further discussion? I recognize the author of the bill, the member from Anoka, Representative Koegel.
Thank you, Mr. Speaker, and to everybody who worked on this. It was truly a bipartisan lift. And, you know, I do want to bring it back to the fact that over 98% of the transactions at these kiosks are related to crime and scams. And from the BCA's own reporting, last year, people over 65 lost $25 million in these scams here in Minnesota. And so that's a lot of money for just people over 60. And so I just, again, want to thank everybody for working on this, especially my LA, Alex Wheeler, who's also worked on the previous legislation. And so I hope everybody can support this bill. Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will call the name of the member voting remotely.
Momani Hildsley.
Momani Hildsley, aye.
Momani Hildsley votes aye.
The clerk will close the roll. There being 127 yeas and 7 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is House File 4455. The Chief Clerk will report the bill.
House File number 4455, an act relating to local government, updating terminology related to Ramsey County Human Resources personnel structure.
I recognize the author of the bill, the member from Ramsey, Representative Lee Kay.
Mr. Speaker, I believe there's an amendment.
There's an amendment at the desk. The Chief Clerk will report the amendment.
Lee Kay moves to amend House Law number 4455, the first engrossment. The amendment is coded A2.
Representative Lee Kay to your amendment.
Thank you, Speaker. This is a technical amendment to get us aligned and ask members for their support, please.
Any discussion of the amendment? All those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. From the member from Ramsey, Representative Lee Kay. Explain your bill, please.
Thank you. So House File 4455 is a technical corrections bill for Ramsey County that would allow the county to streamline its human resources management practices and operate in a way that reflects our modern public sector management. And that is the bill.
There being no further amendments at the desk, the clerk will give the bill its third reading.
Third reading, House File number 4455, as amended.
Third reading. Any discussion? I recognize the author of the bill, Representative Lee Kay.
Thank you, Speaker. It's a good bill. Please vote green.
The Chief Clerk will take the roll. The clerk will call the name of the member voting remotely.
Momani Hiltzley.
Momani Hiltzley, aye.
Momani Hiltzley votes aye.
The clerk will close the roll. There being 132 yeas and 2 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is Senate File 3887. The clerk will report the bill.
Senate File Number 3887, an act relating to local government, allowing watershed districts, watershed management organization, and towns to self-insure for certain employee health benefits.
I recognize a member from Scott, Representative Bakeberg. Before you explain your bill, would you like to put the House language into your bill?
I would.
All those, well, the Chief Clerk will report the amendment.
And Senate File Number 3887, the first engrossment as follows. The amendment is coded DEA 3571.
Discussion to the amendment. All those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. Representative Bakeberg, to your bill.
Thank you, Mr. Speaker. Senate File 3887 simply adds watershed districts, watershed management organizations, and townships to the list of local units of government that can pool for health insurance coverage. Current law already allows counties, cities, and school districts to create joint health insurance pools. This bill was brought to me from a group in Scott County called SCALE. It's the Scott County Association for Leadership Efficiency that includes county, city, school districts, townships, and tribal representation. They meet to talk about emerging issues and work collaboratively to solve problems, find solutions before problems grow. One of the issues that came up is that the watershed district was interested in buying into the county's health insurance plan, but found out that statutory language did not allow them to participate. This bill is supported by the Minnesota Watersheds, the statewide association of watershed districts, and the watershed management organizations. There's been no opposition heard in committee. I want to take time and thank Representative Tabke, Representative Chaw, and Representative McDonald as co-authors as well. Thank you, and I encourage a green vote.
There are no amendments at the desk. The Chief Clerk will give the bill its third reading.
Third reading, Senate File Number 3887, as amended.
Third reading. I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. This bill makes sense, and I encourage members to vote green.
Any further discussion? I recognize the member from Hennepin, Representative Nadeau.
Thank you, Mr. Speaker and members. Would Representative Bakeberg yield for a couple of questions?
He will yield, Representative Nadeau.
Thank you, Mr. Speaker. Representative Bakeberg, do you have any knowledge of any watershed management organizations or watershed districts that have more than 100 people?
Representative Bakeberg.
I am not aware of any watershed districts that have more than 100 people.
Representative Nadeau.
Thank you, Mr. Speaker. And Representative Bakeberg, if he would yield one more time.
He'll continue to yield, Representative Nadeau.
Are you aware of anything can you explain that there's a prohibition that exists, if there is a prohibition that exists between a watershed management organization, a town, or a watershed district from entering into a joint powers agreement to actually access a self-insured health care program? Are you aware of any prohibition right now that doesn't allow that to occur?
Representative Bakeberg.
Thank you, Representative Nadeau, for the question. I am not aware, but this bill came to me through SCALE, like I talked about in Scott County, and there were some issues with clarification where the watershed district wanted to join an agreement with the county, and they were told they weren't able to do that. So that is why I'm bringing the bill to address this, to provide clarity for my constituents in my community.
Representative Nadeau.
And thank you, Mr. Speaker, and thank you, Representative Bakeberg. And I appreciate you spending so much time prior to this talking to me about this bill. But I struggle with it. This is a small bill, but I think it has some impacts. I mean, right now, watershed district, watershed management organization employees are required to access their insurance through the commercial market. And members, for those of you that don't know, our commercial market is shrinking in Minnesota. We are down around 14% of our population that go into the commercial market. And so moving people into self-insured markets, which may be more cost-effective, it may be not, but one thing is for sure, that if you're in a public program, employees pay a very small amount of their premium. And so it might be good for the employees, but it's going to be ultimately bad for our commercial insurance market. We should be doing everything in our power to putting more people into our commercial market. That's the market that we regulate. When we put mandates in place, if it's IVF, if it's GLP-1s, that's the market that we regulate. And self-insurance doesn't necessarily mean that it's an ERISA plan where we don't have access to that. Not all self-insured, fully insured plans are ERISA plans. And so currently right now, in statute, when we pass a mandate, it applies to the self-insured market as well, unless there's a collective, and unless there's a certified union that agrees that they don't want to cover that mandate. And so this is, friends, it's a complicated thing, and I appreciate you for bringing this. I don't know if I want to vote for this or not, because I wish it would have come to health. I wish it would have went to commerce, because that's where this discussion should have occurred. But members, just realize that the more people that we take out of our commercial market, it increases the premium costs on the people left in it. And we need to be focusing on doing everything we can to reduce those premiums. Thank you, Mr. Speaker.
Any further discussion to the bill? I recognize the member from Scott, Representative Bakeberg.
Thank you, Mr. Speaker. Thank you, Representative Dole, for the conversations we had previously and for sharing your perspective. I think it's important that we hear multiple lenses. But this is essentially a local government flexibility bill to help make healthcare affordable for my community right now. And that's what Scale has been asking for, so I want to continue to do that. I would encourage a green vote. Thank you.
There being no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the name of the member voting remotely.
Momani Hildsley.
Momani Hildsley, aye.
Momani Hildsley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is House File 3589. The chief clerk will report the bill.
House File number 3589, an act relating to elections, permitting a voter to briefly leave a polling place to address an unexpected need at the discretion of the head election judge.
There are amendments at the desk, but without objection, we'll allow the author to explain the bill. I recognize the member from Heintzeman, Representative Gordon.
Thank you, Mr. Speaker. HF 3589 would allow a voter to briefly leave a polling place to address an unexpected need at the discretion of the head election judge. An unexpected need would be things like a drink is spilled on your pants, your toddler had to use the bathroom, or the baby just spit up, those kind of things. We did work with the Secretary of State's office on the language of the bill, and I'd be happy to answer any discussion and questions after we hear the amendments.
There is an amendment at the desk. The Chief Clerk will report the amendment.
Quam moves to amend House File Number 3589, the first engrossment. The amendment is coded A2.
I recognize the member from Olmsted, Representative Quam.
Thank you, Mr. Speaker. This amendment mainly changes challenger to observer, and it does extend, for the purpose of this section, a polling place including any location where ballots are cast or counted, included in a polling place established for voting on Election Day, and the absentee or earlier voting locations established. Basically, it adds that an observer is allowed where they're actually voting and on days where there's voting. So I hope that we can change from challenger to observer, and thank you.
I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. Thank you, Co-Chair Quam, for offering this amendment. First of all, I'd like to request a roll call on the amendment, Mr. Speaker.
There being 15 hands, there will be a roll call. Representative Freiberg.
Thank you. And just to be clear, I'm only requesting the roll call to make sure there isn't an issue counting votes. I'm not trying to be aggressive here. Yes. Was that an ironic statement? Okay. So thank you again, Co-Chair Quam. I appreciate you bringing this forward. I do understand the goal of this amendment is transparency, but there are a couple problems with the amendment. The first is a logistical problem. So under current law, every nonpartisan candidate is eligible to have a challenger appear at a polling location, as well as every ballot question is allowed to have a challenger. Major parties are likely limited to one challenger, but each nonpartisan candidate and ballot question is allowed a challenger as well. So the amendment leaves those provisions in place, but renames challengers as observers, as you said, Co-Chair Quam. But it does more than just rename observers. So, currently challengers under current law are allowed access to precinct-level polling places, but this gives them newly rechristened observers access to early vote locations as well, and not just precinct-level places. And these early vote locations can cover much larger areas than an individual precinct's polling place. So this could mean that there are potentially hundreds of observers in a county election office in a county like Hennepin during a general election. Absentee voting spaces and absentee ballot board spaces are not infinite. There's a potential for tens to hundreds of observers to show up at various county courthouses. The county or city will need to have more staff on hand to manage observers, adding to local costs. The second problem relates to the privacy of voters. On lines 2.30 to 31 of the amendment, that could potentially be problematic in that many of these spaces include reference to voters' private identifying information like driver's license numbers, last 4 digits of their social security numbers, and so forth. Observers are, under the amendment, allowed to observe activities, but what activities they are is not specified. So I think the language in the amendment could be clearer. Because of the necessity to protect voters' private identifying information, which is shared during the absentee voting process, both in person and at the ballot board when processing returned ballots, the observers will need to stay away from the process. But challengers under current law and observers under this amendment can only challenge voters based on personal knowledge that the individual is not an eligible voter. So, there are some privacy constraints. We don't know how the observers would know who is voting, how they will be able to use the personal knowledge to challenge their eligibility. It just kind of in short, I think the goal here is laudable. As I said, it's transparency. It would have been preferable for this version of this language to be heard in committee, just to get input from the local election administrators. Making a change to add tens to hundreds of new folks in an observer role has to be set up in a way that works for everybody. So anyway, at this point, unfortunately, I do appreciate the goal, but I can't support the amendment, and I would encourage members to vote no.
Any further discussion to the amendment? I recognize the maker of the motion, the representative from Olmsted, Representative Quam.
Thank you, Mr. Speaker. And I'm flabbergasted and shocked. I heard tens or hundreds of, challengers or observers. If you actually look at, you all got a copy of the amendment, look at line 2.2. And this is language that's present already and just shows the changes. Only one, and the language was challenger, now it's observer. only one from each major political party for each precinct shall be allowed to remain in the polling place at one time. I don't think we've got 10 major political parties in the state of Minnesota. So therefore, there can't be 10. According to the actual verbiage in statute as shown on the amendment. Right now, I think there's 2. And frankly, allowing observers where they're counting ballots, I don't understand why we don't want to have open, transparent elections to the point of where we're reassured things are going right. In the last year, there have been multiple convictions of voter registration fraud, multiple occurrences of where people that are not citizens of the United States have received. One was an absentee ballot, was sent to him. He was legally here, but wasn't a citizen. He came forward to let people know that he received, so an absentee ballot was sent to him by our election system. That's an obvious error. Another one just recently in the news is a person not legally here is being prosecuted for voting. There's a lot of stuff going on and back and forth. Our elections need to have integrity and the general populace to see that it's fair. And by having and allowing observers from just the 2 major parties, you've got independent verification that things are going correctly. And frankly, anyone that says there's not any concern hasn't, again, realized the multiple convictions and the multiple cases where there have been problems with our system. So this is pretty simple. I thought observer is a nicer term than challenger. You're observing, and people can understand that. And frankly, I'm glad a roll call was asked for, because I want to understand everybody that doesn't believe that we should actually have observers and have good popular view that we have integrity in our elections. So please vote green.
Seeing no further discussion on the amendment, the clerk will take the roll. The clerk will call the names of the members voting remotely.
Momani Hildsley.
Momani Hildsley, no.
Momani Hildsley votes no.
The clerk will close the roll. There being 67 yeas and 67 nays, the amendment is not adopted. There are no further amendments at the desk. The chief clerk will give the bill its 3rd reading.
3rd reading, House File number 3589.
3rd reading. I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. So without the amendments, this bill is acceptable. We made some changes in committee to tighten the language. If it does advance in the other body, there may be an opportunity to tighten it further, but it may address a situation that can happen in polling places, and I'm comfortable supporting it at this point.
Any further discussion? I recognize the author of the bill, the member from Isanti, Representative Gordon.
Thank you, Mr. Speaker. You know, this being my first bill, I wanted to get in on the running song lyric bit. And so I was bringing some song lyrics to my wife and kind of going over them with her, and she said, "Is that really how lame your jokes are down there?" I said, yeah, it is. So if you don't mind, pretend that I inserted a Tyler Childers lyric here and delivered a spectacular joke with perfect wit and charm. So it's a good bill. Please vote yes.
Seeing no further discussion, the clerk will take the roll.
A lot to keep straight.
Members, please vote. The clerk will call the names of the members voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 131 yeas and 2 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 3719. The Chief Clerk will report the bill.
House File Number 3719, an act relating to campaign finance, requiring the Campaign Finance and Public Disclosure Board to conduct a study and administer a pilot project related to the use of the campaign finance reporting software by local candidates.
I recognize the author, Representative Gordon, who will explain the bill.
Thank you, Mr. Speaker. HF 3719 creates a pilot program allowing local candidates to use the Campaign Finance Board's reporting software that's available to all of us. The pilot program will take place in at least 4 jurisdictions, must include at least 1 county, 1 city, and 1 school board election, and at least half of the jurisdictions selected must be outside the 7-county metro area. We worked with the Campaign Finance Board on the timing of the pilot program, and they are willing to absorb any associated costs.
There are no amendments at the desk. The Chief Clerk will give the bill its 3rd reading.
3rd reading, House File Number 3719.
3rd reading. I recognize a member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. Thank you, Representative Gordon. This is a good bill. I encourage members to vote yes.
Any further discussion? I recognize a member from Isanti, Representative Gordon.
Thank you, Mr. Speaker. Vote yes.
There being no further discussion, the Chief Clerk will take the roll. Members, please vote. The clerk will call the names of the members voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 134 yeas and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for today is House File 4239. The clerk will report the bill.
House File Number 4239, an act relating to campaign finance, modifying certain requirements for reports and disclaimers.
There are amendments at the desk, but if there is no objection, we'll let the author explain the bill before we act on any amendments. I recognize a member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. This bill contains changes requested by the Campaign Finance Board, mostly to respond to court decisions. So first, under current statute, a lobbyist principal is required to report expenditures for grassroots lobbying advertising that exceeds $2,000 with information provided on the name of the vendor, the service provided, and the subject of the advertising. A federal court issued a preliminary order finding likely constitutional problems with this provision. The Campaign Finance Board consulted with the Attorney General and determined it would be best to repeal this provision. That is what Section 1 does. Section 2 creates a new disclaimer requirement requirement for grassroots lobbying advertisements. This disclaimer requirement is to provide information on what association is asking the public to contact public officials, including legislators, for legislative action. Section 3 removes an obsolete reference, and Section 4 addresses the size requirements for campaign disclaimers on outdoor signs. The statute states that the disclaimer must prominently include a disclaimer, but does not define the word prominently. This led to litigation, and if the legislature does not act, the Campaign Finance Board will likely need to promulgate an administrative rule to define this term. This section puts in specific requirements and exempts existing signs. So, and with that, I'm happy to turn to amendments or questions as the speaker decides.
There's an amendment at the desk. The clerk will report the amendment.
Quam moves to amend House File Number 4239. The amendment is coded A6.
I recognize a member from Olmsted, Representative Quam.
Thank you, Mr. Speaker. This is fairly straightforward. Like the rest of the bill, the Campaign Finance Board is trying to update and make things work and function better. There has come up recently of where there are repetitious and basically, I guess accusations or something come up, and they'll do one person, then they'll do another person, and in order to not spend and burn a lot of the campaign finance time on repetitious, baseless, and previously resolved issues, this would say that they come across it and they can dismiss something that they've already determined is baseless. And I ask for a green. Thank you.
There's an amendment to the amendment at the desk. The chief clerk will report the amendment to the amendment.
Freiberg moves to amend the Quam amendment to House File Number 4239. The amendment to the amendment is coded A7.
I recognize a member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. This secondary amendment, which I hope will be regarded as friendly, reflects a suggestion from the Campaign Finance Board to include the language in the relevant paragraph. This paragraph concerns whether or not there is a prima facie violation, and placing the language here ensures members of both parties can review complaints. So I'd encourage members to support this secondary amendment.
Discussion to the amendment to the amendment. I recognize a member from Olmsted, Representative Quam.
Thank you, Mr. Speaker. And I'm intimidated by your amendments and stuff on me, so I'll accept this one, Co-Chair Freiberg. Thank you.
Seeing no further discussion, all those in favor of the amendment to the amendment, please signify by saying aye. Any opposed, say nay. The motion passes. The amendment to the amendment is adopted. On to the amendment. I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. I am equally intimidated by Co-Chair Quam's amendments, but with this change that was made by the secondary amendment, I think it puts this in good shape, and I'd encourage members to support it.
Any further discussion to the amendment? Seeing none, all those in favor, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Freiberg moves to amend House File Number 4239 as amended. The amendment is coded A3.
I recognize a member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. So this is an amendment reflects some language suggested by the other body on a bipartisan basis. It puts some more specificity into the requirements related to lawn signs and makes a distinction between large lawn signs and really large lawn signs. The Campaign Finance Board says it's workable, so I hope members would support this amendment.
Discussion. All those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Freiberg moves to amend House File Number 4239 as amended. The amendment is coded A4.
I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. This amendment is based on a bill I developed in consultation with the Campaign Finance Board Director after the events of this past June. And I don't really want to revisit those events, but suffice it to say the public availability of the home addresses of many legislators puts our safety at risk. There are many locations where private data might be available, and there are other bills that address some of those locations. This amendment addresses locations that relate to us as candidates and legislators, the Campaign Finance Board, and the Secretary of State's office. As I understand it, immediately after the events of June 14th, the Campaign Finance Board pulled down candidate addresses from places like the committee registration page. But there were other spots within the Campaign Finance Board website where our information is still available, and the board felt that legislation would help address those locations as well as making their actions of June permanent. So that's what this amendment does. So it was heard in the Elections Committee and the Judiciary Committee. We put on some amendments to reflect concerns of both parties, and I would encourage members to support this amendment.
Any discussion? Seeing none, all those in favor of the amendment, please signify by saying aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Freiberg moves to amend House File Number 4239 as amended. The amendment is coded A5.
I recognize the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. With the adoption of the A4 amendment, this amendment is no longer necessary, so I will withdraw the A5 amendment.
Representative Freiberg withdraws the amendment. There are no further amendments at the desk. The chief clerk will give the bill its third reading.
Third reading, House File Number 4239 as amended.
Third reading. Discussion of the bill. I recognize the author of the bill, the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. This bill, as amended, addresses important issues, and I hope members will vote green.
There being no further discussion, the clerk will take the roll. Members, please vote. The chief clerk will call the names of the members voting remotely.
Momani Hiltsley.
Momani Hiltsley, aye.
Momani Hiltsley votes aye.
The clerk will close the roll. There being 122 yeas and 12 nays, the bill is passed as amended and its title agreed to. Motions and resolutions. Members, there are copies of the non-controversial motions at the House desk and online. If there is no objection, we'll take action on these motions first. Hearing no objections, the motions prevail. Announcements. I recognize the member from Itasca, Representative Igo.
Thank you, Mr. Speaker and members. Well, it is officially the best day of the legislative session. Today is the highly anticipated Ranger Party at Mancini's. It's going to be at 5 o'clock, so we can wrap up here and head on down. Many people from the range came down to be here, so come on down for some collaboration and some fun with your favorite party of the year.
You're out of order, Representative Igo. It is not the greatest one. That's the I-90 party. Thank you, Representative Igo. Announcements. I recognize a member from Anoka, Representative Niska.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 6 p.m. Tuesday, April 28, 2026.
Representative Niska moves that when the House adjourns today, it adjourns at 6 p.m. Tuesday, April 28, 2026. All those in favor say aye. Those opposed say nay. The motion prevails. Representative Niska.
I move that the House do now adjourn.
Representative Niska moves that the House do now adjourn. All those in favor say aye. Those opposed say nay. The motion prevails. The House stands adjourned until 6 p.m. Tuesday, April 28, 2026.